Hey, you guys, and welcome back to another episode of Kidney Diaries. So, today we're talking about hematuria, which simply means there is blood or red blood cells present in the urine. In simple terms, this means that something along the urinary tract is allowing a small amount of blood to mix in with urine. So, sometimes it's visible to the eye. The urine may appear to be a pink, red, or even tea colored. And other times, it can only be detected under a microscope during testing. So the only time you would have known of it is if you went to the doctor and the doctor looked at your urine under a microscope and they let you know that you had red blood cells present in your urine, or they told you that you're experiencing hematuria. So by the end of this video, you'll have a clear understanding of what hematuria is, what can cause it, and the common tests used to figure out where the bleeding is actually coming from. All right, you guys. Sorry I've been gone for so long from posting a long form video, but I have been on vacation. Now, before we jump into the causes, let's do a quick anatomy refresher. So, understanding the urinary system makes it much easier to understand why blood may show up in the urine and where exactly it might be coming from. So I'm going to put here on the screen some diagrams for you guys. So let's take a quick look at the urinary system. First, we're going to start with the male urinary system. So the male urinary tract includes the kidneys, you have the ureters, the bladder, here is the prostate, you have the urethra, and the penis. So the kidneys act like the body's natural filters. They clean the blood and they produce the urine. The ureters are thin tubes that carry urine from the kidneys down to the bladder, and that's what you see right here. The bladder is a storage pouch that holds urine until you're ready to go to the bathroom. So the urethra is the final tube that allows the urine to actually leave the body. Right here, what you see sitting on top of each kidney are the adrenal glands. So these are not part of the urinary system itself, but they are closely located and they belong to the hormone or the endocrine system, which is helping to regulate things like stress hormones and blood pressure. So in men, the prostate glands sit just below the bladder and wraps around parts of the urethra. Because of its location, if the prostate becomes enlarged or inflamed, it can affect urination and sometimes contributes to blood in the urine. At the bladder outlet, there are two control valves. These are called the sphincters. There are two sphincters. So there's the internal urethral sphincter. This is the involuntary control. And then you have the external sphincter, which is the voluntary control. What these do is help control when the urine is released from your body. Next, we're going to take a look at the female urinary system. So, just like the male, only a slight difference, the female urinary tract includes the kidneys, the ureters, the bladder, the urethra, and the external opening, which is where the urine exits the body. In women, the urinary system sits very close to the reproductive organs, including the uterus, the ovaries, the fallopian tubes, and the vaginal opening. This is important because sometimes symptoms that look like blood in the urine may actually be coming from the reproductive system. So, for example, you have menstrual blood or vaginal bleeding can sometimes be mistaken for hematuria. This is why proper testing is so important. Now I want to talk about what does the timing of blood actually tell us. This timing can give important clues about where the bleeding might actually be coming from. The first one being blood at the beginning of the urination. So if blood appears only at the start of urination, it may suggest the source is in the urethra, which is the tube that the urine passes as it leaves the body. This is because the first urine flushes out the urethra. The second timing is going to be blood at the end of urination. We call this terminal hematuria. So if blood appears only at the very end, it may suggest that bleeding is coming from the bladder neck or any nearby structures, since these areas empty last. The third timing is going to be blood throughout the entire stream. This is what we call total hematuria. So if the urine is bloody from start to finish, this often will suggest that the source is higher up, such as coming from your bladder, your ureters, or your kidneys. In other words, the blood is mixing with the urine before it even reaches the bladder. Now let's go through the most common reasons someone might notice blood in their urine. The first cause could be recent medical procedures. Sometimes hematuria is temporarily and expected after procedures such as catheter placement, which is a tube that gets inserted into the bladder. This can also happen after urethral stent placement and prostate biopsy. These procedures can slightly irritate or injure the delicate tissues, leading to short term bleeding. Our next cause is enlarged prostate, also known as BPH. In men, a very common cause is benign prostatic hyperplasia, which is what BPH stands for. This simply means an enlarged prostate. So, as the prostate grows, it can press on the urethra, which makes urination more difficult. It'll also cause small blood vessels to become irritated and bleed. Moving along to our third cause, and this one is infections. Infections are another very common cause. You have cystitis, which equals infection of the bladder. It often causes burning urgency and frequent urination. Another infection would be urethritis. This one is an infection of the urethra, which may cause pain or discharge. Our last infection is pyelonephritis. This one is an infection of the kidneys. This is more serious and may include fever, back pain, and feeling very unwell. So when these tissues become inflamed, small blood vessels can break, which leads to blood in the urine. Our fourth cause is trauma or injury. So these can be injuries such as blunt force to the abdomen or the back. This can come from sports injuries, accidents, medical instrumentation, or even trauma can sometimes irritate sensitive urinary tissues. Another cause is tumors or cancers. So growths anywhere along the urinary tract, including the kidneys, the ureters, the bladder, or the prostate, can sometimes cause bleeding. This is why persistent or unexplained hematuria is always taken seriously and investigated further. So our next one can be kidney-related causes. The kidneys contain millions of tiny filters called nephrons. If these filters become damaged, blood can leak into the urine. One example is glomerulonephritis, which means inflammation of the kidney's filtering system. So this can happen due to infections, autoimmune diseases. This is where the immune system attacks the body. Long-term diabetes, high blood pressure, and certain medications or toxins. The next cause is kidney stones. Nephrolithiasis, which is kidney stones, is another very common cause. So these are hard mineral deposits, often made of calcium oxalate, that form inside of the kidneys. When they move into the ureters, it is called erythrolithiasis. And I hope I'm saying that right because I could be messing that word up. I'm an herbalist and a clinical herbalist in training. I'm still learning how to pronounce these big words. So kidney stones often get stuck in these narrow areas. The ureter pelvic junction. This is where kidneys meet the ureters. This is the point where the ureters cross the pelvic brim. Here we have the uretrovesica junction, where the ureters enter the bladder. So when a stone gets stuck, it can cause severe pain. This is often called renal colic. This is irritation of the lining. And this can also cause blood in the urine. Our next cause is polycystic kidney disease. So what this is a genetic condition where fluid-filled cysts grow in the kidneys. And over time, these cysts can grow larger, rupture, or bleed, and these cysts can also affect the normal kidney function. This can lead to visible or microscopic blood in the urine. So you may notice and you may not notice the bleeding within the urine if you have this problem. Let's talk about causes specific to women. There's a few additional considerations in women. The first one being endometriosis. This is tissue similar to the uterine lining, which grows outside of the uterus, and it may involve nearby organs, which sometimes mimic the urinary symptoms. We also have pseudohematuria. This is when urine appears bloody, but the blood is actually coming from the vagina. Given an example, your menstruation. So when you're on your menstrual cycle, obviously you're going to have bleeding within the vaginal canal, and that is going to mix with your urine when you go to the restroom. Another one is post intercourse irritation. So sexual activity can sometimes cause minor trauma and temporary spotting. Believe it or not, vigorous exercise or any intense physical activity can occasionally cause temporary hematuria. This is especially seen in endurance athletes. Another one is blood clotting disorders. So these are conditions that affect how the blood clots properly. And this is called coagulopathies or coagulopathies. This can also lead to hematuria. In these cases, even small irritations or normal activities may cause bleeding because the body has a harder time stopping it. Now, after all of that information, I know you guys may be asking, how do we investigate hematuria? Like, how do I know when to be alarmed if I see blood in my urine? So, healthcare providers use several tests to find the cause. The first test is going to be a complete blood count, which they call a CBC. What this test does is check if there is anemia. So, this is going to be a low blood count from the blood loss. If there are signs of infection, this is going to be high white blood cells. So your doctor may check to see if you have high white blood cells because that's going to indicate that you have an infection. Number 2 is going to be urine analysis. This is one of the most important tests. This test helps to confirm if your red blood cells are truly present, if there's protein, bacteria, or any other abnormalities. The third one is going to be urine cultures. So this test is going to check for bacteria. What this does is simply confirm or rule out infection. Our fourth one is going to be coagulation studies. So these tests are going to evaluate how well the blood is clotting, especially if a bleeding disorder is suspected. Our fifth test is going to be an ultrasound. So an ultrasound or a CT scan. These scans will allow the doctors to see inside the urinary system to look for things like kidney stones, tumors, cysts, or any structural abnormalities. Our sixth test is going to be cystoscopy. So this is a procedure where a small camera is inserted into the bladder. This is so that the doctors can directly inspect your lining. This test is going to be especially important in adults that have persistent hematuria, risk factors like smoking, or anyone over the age of 40. Another one is going to be PSA tests in men. This blood test is going to help evaluate the prostate health, and it can also provide us clues about BPH, which is enlarged prostate inflammation, or any diseases. All right, you guys, I know that was a lot of information, but the goal of these tests is simply to figure out where the blood is coming from and why it is happening so that the right treatment can be started or the right herbal protocol can be given to you guys. Keep in mind that hematuria can range from something harmless and temporary to something that needs urgent attention. This is why proper evaluation is so important. It was great talking to you guys, and if you found this episode of Kidney Diaries helpful, don't forget to like, subscribe, and share it with someone who wants a better understanding of how the kidneys actually work. Remember, if your kidneys are always telling you a story, you just have to know how to listen. I'll see you in the next episode. Wait a minute. I was about to let y'all go. Wait a minute, because I actually needed to make an announcement and I completely was about to forget. So, as I stated before, I have not posted long form content in a while because I have been obviously studying. I'm in school, and then I took a week cruise vacation with me and my man, who is now my fiance. Yes, you guys, I got proposed to on my cruise. Y'all, this man proposed to me on the cruise at dinner. It was so beautiful. I'll try to post a short of it if I don't add it to the end of this video. If you want to see that, go to my YouTube shorts so you can see my proposal. It'll completely not be about health, but for those that love my journey and want to see more about my life, go to my shorts, and I will go to my shorts or go to, actually, you know what? Go to my TikTok because I posted it on my TikTok already. I still may post it here. I'm not exactly sure, but it's already on my TikTok, which will be linked in the description below. As stated before, it was great talking to you guys today. I will see you next time. Oh, wait, another disclaimer. I am going to be doing a lot more studying because I have to catch up from my cruise. So I need to do a lot more studying so that I can give you guys more content. And I also need to start working on my formulas and my website. So a lot of my content may start coming out short form until I get ahead. And then I'll come back and give you guys some long form videos as I was doing before. But nevertheless, you guys will see me around. Follow me on my TikTok, my Instagram, and don't forget to subscribe to my YouTube channel. Share this with your friends, your family, your mama, your daddy, your sister, your brother, your cousin, or anybody that wants to learn about their kidneys. And in the future, I will be talking about more than just the kidneys. So stay tuned. See you guys next time.